This video demonstrates how to set up and perform an ultrasound scan of the kidneys, bladder, adrenal glands, and renal vessels. Equipment required includes the following: an ultrasound machine, a selection of transducers, an examination table, positioning aids such as wedge sponges or pillows, a chair, acoustic gel, examination gloves, bed linen and towels, and a sonographer's worksheet. Ensure that the patient is well hydrated and has a full bladder. Explain the technique of breath holding during the scan. Ask the patient to lie supine on the bed and make them comfortable with the use of pillows or wedges, positioned as required. Expose the patient's abdomen and apply pre-warmed acoustic gel to the upper abdomen. Select a transducer of the appropriate frequency. Confirm the correct transducer selection and preset on the ultrasound machine. Perform a survey of the abdomen and make any necessary adjustments to the machine settings to maximize the image quality. Begin by scanning the right kidney. Ask the patient to lie in the left lateral decubitus position. The most useful transducer positions for kidney imaging are the subcostal and intercostal approaches. Apply warmed acoustic gel to the flank along the right subcostal margin and place the transducer in the same area. Rotate the transducer into an oblique plane so that it lies just below and parallel to the ribs. Ask the patient to take a deep breath in and hold it. Using the liver as a window, sweep the transducer to the right to obtain longitudinal images of the right kidney, including the medial and lateral margins. Freeze and annotate 3 separate longitudinal images of the right kidney, one for each of the medial, mid-sagittal, and lateral views. Obtain a measurement of the length of the kidney in the mid-sagittal view from the superior to inferior pole. Print or save the image and then press the freeze button to continue. Rotate the transducer and sweep to obtain transverse views of the right kidney from superior to inferior. Obtain 3 transverse images, one each at the level of the superior pole, hilum, and inferior pole of the kidney. If any pathology is identified in the kidney, color flow may be used to further evaluate the pathology. If overlying bowel gas obscures the image, the patient position may be varied between lateral decubitus and posterior oblique, and the transducer approach varied from subcostal to intercostal as required. Repeat the steps for scanning the left kidney with the patient in the right lateral decubitus position. To scan the urinary bladder, ask the patient to lie supine on the table. Apply pre-warmed acoustic gel to the lower abdomen along the midline. Place the transducer in the midline, just superior to the symphysis pubis in the longitudinal.